Dear attendees, thank you all for finding time to attend today's webinar. We are very happy to welcome Dr. Dominika Kozak from EGZOTECH. She'll be sharing with you usage of advanced robotic and EMG-based technologies for inpatient, outpatient, and in-bed rehabilitations. So without further ado, let's all welcome Dr. Kozak. Dr. Kozak, please.
Good morning. I'm happy to present you a little bit about Luna EMG, the neurorehabilitation robotic device. So the topic of my presentation is the usage of advanced robotic and EMG-based technologies for inpatient and outpatient and in-bed rehabilitation. What are we going to talk about? A little bit about the fundamental concepts which goes behind Luna EMG and EMG itself, and then I would share with you our experience with patients. So first of all, what is Luna EMG? It is a combination of surface EMG and robotic assisted approach. So this is a robotic device for neurological, clinically weak patient. And how does Luna work? So in the patient brain, there will go the intention, it starts the intention to move. And then the EMG sensors, which are placed on the limb, capture the voluntary electrical activity of the muscles, so they capture the EMG signal, and then Luna EMG recognize and responds to the user desire to move through the real-time interactive EMG signal displayed on the screen. Here comes the positive feedback from the biofeedback mechanism, which enables the motor learning and the muscle reeducation. But what actually is the surface EMG and the EMG biofeedback? So electromyography is a technique for evaluating and recording the electrical activity produced by skeletal muscles. EMG biofeedback is a method of retraining muscle by creating new feedback systems as a result of the conversion of myoelectrical signals in the muscle into visual and auditory signals. EMG biofeedback can be used to either increase activity in weak or paretic muscle, or it can be used also to facilitate a reduction in tone. So when we think about the spastic ones. EMG biofeedback has been shown to be useful in both musculoskeletal and neurological rehabilitation. Here on the screen you can see the video. We asked the paraplegic patient to move voluntarily their limb. So we wanted just visually to assess the movement possibilities of the hand, of the arm. We wanted to contract the him to contract the biceps. Yeah, in comparison, the left hand was more movable, but there was more muscle activity. Hand. And we've put the electrodes and the EMG on the body, and the patient voluntarily contract the movement and contract the muscle, and the electrodes took the muscle signals. So Luna responds accordingly, and here you can observe the assistive mode of Luna EMG, which is based on the real-time muscle activity of the patient, even though the activity is very low. That's because we have the most sensitive EMG on the world, so that it's really possible to conduct the therapy even with the very weak patients with the minimum muscle tone. About the experience with patients, Luna can be both the diagnostic and assessment tool as well as the intervention. Quick EMG assessment we can do with the EMG, the specific muscle assessment, find out does a specific muscle actually work or not before we therapy. So from the assessment, you can see that we can assess the muscle activity through the surface EMG, and here you can see on the screen that there is the traditional diagnostic approach with the MRC scale, and the muscles were assessed almost with zero. Whether the EMG-based assessment approach, we can see that the contraction of the muscles is about 20 or 25 microvolts. The muscle force we can assess by using the isokinetic testing. So here comes the program dynamic reversal, which is dedicated for the patients with the minimal muscle tone 3 to 5. And the patient receives the resistance that he generates on the device, and the resistance is changing, fully adapting to the musculoskeletal system, pain, and the fatigue. So when the speed of movement increase, the strength also increase. After each training, the device generates the report on which you can see the muscle activity from the EMG, and then you can see the range of motion on which it was working, and also the maximum contraction. We can also assess the proprioception. So for that we use the proprioception test, and we have already made a small proprioception test among the 10-stroke patients, and the best results, of course, we received on unaffected side with eyes open. Another possibility of assessment is the range of motion test. So the patient is doing the test passively and then actively. In the diagnostic mode, you can compare the passive range of motion and active range of motion, and then the device counts the deficit. Luna is mostly known also as a training tool, so we can work with all kind of patients and all kind of movement abilities. So where there is no movement and no activity, so absolutely zero, here we can use our passive exercises. Where there is activity but no movement, so the patient needs the assistance, like the gentleman on the video, we can use the reactive electromyography and EMG biofeedback. But also where there is actually activity and movement, so the patient can have the therapy resistance, we can use the dynamic reversal, elastic resistance program, weightlifting, and also proprioception exercises. We have different extension for working, for exercising with the robots. So you can see there is the arm extension, the elbow extension. You can exercise with the wrist, also with the trunk by using the steering wheel. There are exercises based on the EMG connection, and you can also provide the exercise for the lower limb, so for the knee, for the hip, and for the foot, especially for the foot drop. And the exercises can be provided both in sitting, lying, supine, and standing position. Here on the video you can see the stroke patient who is training the arm with the arm extension. So he's training the flexion and the extension of the arm. Nowadays, when we have a lot of COVID-19 patients which are immobilized in bed, we also can adapt Luna EMG for the bedside training. So on the screen, you can see our in-bed therapy experience. So you can work with the very, very severe cases who are immobilized in bed, who needs to be controlled by different several monitors and cannot really go to the training room. So Luna comes here to train also with those patients, and they can be actively mobilized by using their own muscle activity. So the training can be also provided in the sitting position next to the bed, in supine position, and also in sitting position. It all depends on the patient's actually condition and own abilities. Yes, here you can see the patient is training the trunk in sitting position with the steering wheel. Luna EMG can be also used at the hospital wards because it's really easy to disinfect, and you can place it from one place to another and train with many different patients. So it's easy to use in the hospital setting. And as you can see, Luna EMG can be both the training and the assessment device. So you can both assess and check and diagnose your patient, and then based on the very precise diagnosis, you can make the training program and exercise with your patient. Thank you for your attention. I'm happy to hear your question if you have any now, or you can contact me by email, which is dominika.kozak@exotech.com.